Good evening, everyone, and welcome back to another episode of HealthWise. I am your host, Dr. Joeann Davis, and with me I have the medical scientist, Ms. Clilia Davis. In commemoration of World Health Day, the theme that we're going to go with tonight is antenatal care and newborn health. Ms. Clilia, would like to introduce you to the audience.
Sure. Good evening, everybody. My name is Clilia Davis. I'm a medical scientist, and I am overjoyed to be here this evening in my inaugural episode. So it's going to be a great one.
Tonight we have with me as well two special guests. I'll have them introduce themselves to you all.
Good night. I am Miss Mary Caines, clinical instructor at Joseph M. France General Hospital.
Good evening to everyone. My name is Miss Doris Bradshaw-Smith. I'm the community nurse manager for the Molieux Health Center, and I'm delighted to be here this evening.
All right, so this panel, we're so excited tonight to have you with us, and we're so excited to expound on this topic. We think that it's very, very important. And so we're going to jump right in. So what's the format for tonight? Tonight we are going to talk about, as I said, antenatal care and newborn health, as well as we're going to have featuring medical personnel and our personality spotlight, and we're going to look at what's happening at the JNF hospital in the local media bulletin with Dr. Jensen Morton. All right, so feel free, relax, and get ready to learn as much as possible, all right? Anything else? How are you guys feeling tonight?
Good. Wonderful.
All right. So right now, we're going to take a short break for our sponsors, and then we're going to come back and jump right in to see what we're going to learn today.
Can I get a wow? It's the sound you'll make when you get out alone. From a place you once knew to a dream home come true. Wow, for a home like new. Wow, is the effect you'll get when you upgrade your home.
Upgrade, improve, enhance your home with National Bank's Wow Mortgage. For the effect you'll get when you upgrade your home. Lowest interest rate guaranteed and the most favorable terms.
It's Wow Mortgage. Can I get a wow?
Okay, welcome back everyone, and let's jump right in. So, antenatal care and newborn health. What is antenatal care? Nurse Britt, think you can able to answer that one for us?
Yes, I can. Antenatal care refers to the medical care provided to both mother and the unborn baby throughout the pregnancy. So the goal is to monitor the health of both mother and the fetus. Ensuring early identification of potential risk or complications. It includes basically routine checkups, screenings, and counseling to promote a healthy pregnancy and delivery.
Okay, all right. So, what do you say are some of the tests and screenings that these pregnant women should have, and what exactly are the doctors looking for when they ask, when they go to do these tests?
Okay. All right. So pregnant women typically undergo several tests and screening during the antenatal visits to monitor their health and the baby's development. Specific tests can vary by country, region, or specific medical circumstances. But the common ones are these. In the first 12 weeks of the pregnancy, we'll do some blood tests to check for your blood type, check for your anemia, check for any sexually transmitted infections such as HIV, hepatitis B, and syphilis, which can pass from mother to child during the pregnancy. We also screen the urine to screen for any urinary tract infection, check your kidney functions and your protein levels. We also have ultrasounds to confirm the pregnancy, which will also check for multiple pregnancies, and it helps to determine your due dates. All right, we also do screen in the second trimester. This is between 13 to 26 weeks. We will monitor your blood glucose levels, all right, and check for certain birth defects. We'll do an anomaly screening, ultrasound, which in the 18 to 22 weeks, to check for any abnormalities with the fetus, for any heart defects, spina bifida. And then in the last trimester, we repeat some of the tests that were done in the first trimester, your HIV, syphilis, and hepatitis B. We'll also monitor your glucose levels to see if there's any risk of you developing diabetes. We also do the scan, ultrasound scan, to check the growth of the fetus. All right? So those are some of the tests during your pregnancy stages.
Okay. So how has advances in prenatal screening impacted early detection of complications, and what are some of the stats on false positives and negatives with regards to St. Kitts and Nevis?
Okay, advances in prenatal screening include genetic testing and ultrasound, which have significantly improved, the early detection of complications, allowing for better preparation and management. While these advancements, offer numerous benefits, false positives and negatives can occur, however, and specific statistics for St. Kitts and Nevis are limited, requiring reliance on general trends and studies.
Understand. So you mentioned some of the screening that could take place, and sometimes we hear buzzwords like high risk or low risk pregnancy. So how would you categorize something that is high risk versus a pregnancy that is low risk?
Okay.
Go ahead.
All right. The category, categorizing a risk as a high risk or low risk. If there is any sign of complication, further monitoring or intervention may be done. For instance, if a screening test shows an elevated risk for Down syndrome, the mother may be offered more diagnostic tests like amniocentesis, so you test the amniotic fluid, or CVS to confirm the diagnosis. So you do that in utero to confirm the diagnosis. All right? So that's one. For another example would be for patients with high blood pressure. If you've had a high risk of high blood pressure in your previous pregnancy, we'll monitor you closer during the next pregnancy. For the risk, you might be at risk for preeclampsia, which we'll talk about later down. Okay. All right. Obesity is also put women at risk for gestational diabetes. So those are some of the complications that can put you at high risk.
Understand. And also, do you check for sickle cell disease?
Yes, we do.
In utero. And would a mother who is a sickle cell patient, would she be considered high risk?
Yes, she would.
Okay, so from what I understand, high risk is not just dependent on if the mother is healthy or not. It's also dependent on the fetus, what you see in the fetus. So that's why we test both, right?
Yes.
Okay, so then a low risk would be what? Just generally healthy,
Normal.
just normal, right? So like,
Pregnancy.
so what if, can a patient or a pregnant woman starts off as normal and then
Eventually become high
Yes.
risk. Yes.
okay, so that's common.
Yes. And that's why we encourage your antenatal visits, check-ins with your doctor,
from the get-go.
check-in with your nurses at the health centers.
Yes, when you find out that you're pregnant, it's always best because, many persons actually, they do not know. I think that we're going to speak about that later on. They don't know about antenatal care. And so I want to implore the public. I'm telling you that we give antenatal service, good antenatal service at each health center. So please come on out.
All right then. So I think that's very very educational, because sometimes you might think, okay, we start, we go get our test done, and we figured that once it's enough. The doctor said I was fine, and that's it. So we have to keep going back from the first trimester, second trimester, and third trimester.
And there's a lot to learn. There's a lot of education to give. I find that many persons are missing out on the antenatal care services, especially that which is offered
at the health
centers.
centers.
Oh, okay.
So what would you say would be maybe 2 to 3 tips that you would give an expectant mother within maybe the first couple visits? What are some of the things that I really need to look out for?
What you would tell them?
Okay, some of the things I will tell, basically you're letting them know some of the things that are going to take place, the tests that they're supposed to do, what to expect, because there are many myths that are out there, so you want to educate them and make them aware. You let them know, there's a joy that is going on the inside of you, and you want to do everything to the best of you, to protect you and to protect the baby also. Because whatever you put in your mouth is what what the baby receives. So you want to let them know from the get-go. Come to the health center. We're going to let you know what the whole steps throughout the pregnancy, what you're supposed to eat. We're going to educate them, give them informed, education and so forth.
All right, then.
That's good.
I hope you guys are paying attention because this is really interesting. This has me so captivated.
Yes.
Right? And you see the nurses, they're imploring us to go to the healthcare centers. Once you find out that you're pregnant or you're planning pregnancy, go check up, make sure that your antenatal care is on point. Yes. So we're going to pause for a quick break and we'll be right back, okay? Stay tuned in.
Well, they're going to take breakfast.
Yeah.
So welcome back. I hope you guys are still interested because I really want to know what's going on next. So let's jump right in. Right? So we just spoke about antenatal care, the importance of it. So when it comes to dieting and exercise, right, what should the diet of a pregnant woman be? And what are the antenatal medications for an expectant mother? Like what should she take? What should she put in her body?
Okay. So a healthy diet during pregnancy is vital. It's crucial for the well-being of both the mother and the developing baby. The dietary needs of pregnant women change as the pregnancy progresses. So a little breakdown, mommy needs her carbohydrates. A pregnant woman should focus on whole grains, her fruits, her vegetables for slow releasing energy. She needs her proteins, which includes her lean meat or poultry, fish, which is low in mercury, eggs and plant-based proteins, beans, lentils or tofu. Those are examples that should be consumed to support fetal growth and development. Also, she needs her fat. Healthy fats such as those found in avocados, nuts, seeds, and olive oil are important for the baby's brain development. That's the macronutrients and micronutrients. Also, she needs her folic acid, which is crucial for fetal neural tube development. That is one of the reasons some people wait too long. They wait till like 5 months, 6 months, 7 months, and you have to understand folic acid is very important. It's crucial for fetal neural tube development and should be taken as supplement. And it's also found in leafy greens, fortified cereals, and legumes. Also, iron is iron-rich foods like red meat, spinach, and beans, helps prevent anemia. Pregnant women needs more iron to support the increased blood volume during pregnancy. They also need calcium, which is important for the development of the baby's bone and teeth. Dairy products, fortified plant-based milks, leafy greens, and tofu are excellent sources. I hope that there are some antenatals that are on tonight and that are listening,
That's good information.
Take notes of what I'm listing even now, right? Vitamin D, which supports calcium absorption and bone health.
Yes.
Sources include fortified milk, fatty fish, and sunlight. Okay? They need iodine, which is essential for proper thyroid function and brain development. Foods such as iodized salt, seafood, and dairy products are good sources. They need to be keep hydrated. You know, pregnant women should aim to drink plenty of water, like 8 to 10 cups per day, to support amniotic fluid levels and avoid dehydration. You know, which can lead to complications like preterm labor if they don't hydrate themselves. Okay. Now, some of the foods to avoid. I know we love our KFC. I know that in pregnancy there are so many cravings.
Yes.
You know, and I'm not saying that now and again you can't take a little, but you have to know about your vegetables. One will say, make sure that there are more vegetables on the plate, you know, less rice,
less oils,
and less fried stuff, please. Stew and steaming your stuff is, you know, preferred. And, you know, sometimes when you're pregnant, you have all kind of cravings. You know, so foods to avoid, you avoid raw or undercooked meats, seafood and eggs to prevent foodborne illnesses. You know, unpasteurized dairy products to avoid the risk of listeriosis. Excessive caffeine. Yes, as I said, there's so many cravings. Excessive caffeine and alcohol should be avoided during pregnancy. Persons drink beer now and again in pregnancy, and they also take alcohol in between, and that is not good. You know, certain fish that are high in mercury, like shark and swordfish, should also be avoided.
Okay. So when they say okay, you're eating for two, or you give baby what they want, that's not the case.
That's not the case. You have to eat healthy. You have to eat healthy.
And that doesn't mean to overeat too.
That is true.
Right?
You're not eating for two, you're eating for one, okay? Whatever you eat
is what the baby gets.
Exactly. And so you have to eat healthily.
And healthy diet is very important.
Exactly.
It is so serious. It's very, very important. So many, even with, you know, so many babies, especially mothers, mummies, bring their babies to the clinic, so they feel that, oh, fat and nice, isn't it? But some children can be fat and still malnourished.
That is true. That is
you
true.
have to maintain.
Yeah.
You know,
So it's not
health.
It's not what you just look on the outside, it's what's happening on the inside of the body as well.
Yes.
Okay, so we spoke about diet. What about exercises? Can pregnant women exercise?
Yes.
And in the second trimester, you know, when your belly starts to get real high, is exercises okay? Are exercises okay for pregnant women to do? And what are the types of exercises that, you know, should be done?
All right. So if you're accustomed to exercise, you're pregnant, you don't just give it up. You continue, but you know you do low intensity exercises. So you'll do your walks, all right? Walking, low impact walk exercise, you swim, can go for your swim, you do your yoga, prenatal yoga, Pilates, and your strength training, but they have to be light and moderate, so nothing excessive. You do your pelvic floor exercises, which help in aiding in your delivery and after delivery your recovery. So setting back those muscles back in place and strengthening your pelvic floor. All right, so those are some of the exercises. And what to avoid? Avoid high impact sports, exercises that involve lying flat on your back, especially after your 20 weeks gestation or pregnant, or exercise that can carry a high risk of falling. So we don't want you to fall, injure yourself, and put your baby at risk. For after childbirth, such exercises as pelvic floor recovery exercises, gentle walking, postnatal yoga can help to restore strength and flexibility.
That's really good. So we have good exercises and we have bad exercises. Okay. So not everything. Sometimes we go on Instagram and we see women in like the third trimester and they're just pumping weight.
Lifting heavy weights.
If you're not accustomed. If you're not accustomed to lift heavy, you're not accustomed to sprint, please don't try it when you're pregnant. We prefer that you start before and you gradually ease your way into that, okay? All right. So now that we have an understanding of diet and exercising in pregnancy, we're going to take a quick break and we're going to be right back as we continue this interesting topic.
What's up with you? Girl, you look like you're off in dreamland. Focus.
Focus. It's Valentine's season. Love is in the air.
You not here?
So Dave said he loved me and I have 24 hours to respond. I'm thinking about what I'm gonna say.
That doesn't need planning. When he say I love you, you simply say I love me too.
What's that? And who even does that?
I do.
Me too.
I love you too simply means I love me enough to make myself a priority. And it starts with making wise decisions.
This Valentine's, I choose to abstain and to protect my name.
This Valentine, I choose education now, and this is my solemn vow.
I choose to keep my virginity and maintain my dignity.
Wise choice, because saying yes to him is saying no to you. I choose self-respect over self-neglect.
Okay, I get it now. I love myself too. This Valentine, Dave can keep his love. At this point in life, I choose self-love. For learning to love oneself is the greatest love of all.
Hey babe, you know I love you, right?
I love me too.
And welcome back to this episode of HealthWise, where we've been speaking with our lovely guests here about antenatal care and newborn health. And before the break, we were speaking about pregnancy and the exercise diet that an expectant mother should have. And now that we've spoken a bit about mothers, we want to shift gears a little bit and speak about the daddies and what role they probably would have within a healthy pregnancy. So nurse, speaking about paternal health, even if it is something that is not planned or something planned, are there any risk factors or influences from the paternal's health in terms of the success of pregnancy?
Yes. So, while much of the focus in pregnancy is placed on the mother, paternal health plays a significant role in influencing pregnancy outcomes. Various factors such as smoking, diet, and stress levels, can affect both the mother's health and the development of the fetus. For example, smoking. Some men may not like to hear this tonight, but I have to speak it. Smoking, the effect on pregnancy. Men who smoke can contribute to poor pregnancy outcomes, including an increased risk of preterm birth, low birth weight, and developmental issues in the baby. Smoking can lead to DNA damage also in sperm, yes, which may affect fetal development and increase the risk of miscarriage and birth defects. Studies have shown that prenatal smoking increases the likelihood of a child having respiratory problems, can become asthmatic, and even behavioral issues later in life. Yes, so diet also, sorry.
No problem.
Healthy diet and sperm quality. A balanced diet in father is also important. Men must be wondering tonight, like, what you got to do with that? Men, you have a key role to play in this, A balanced diet in fathers is also important for maintaining healthy sperm and promoting reproductive health. Diets rich in antioxidants, healthy fats, omega-3s, and micronutrients like zinc and folate have been linked to better sperm quality. And I always tell some men who would come to the health center and say that, nurse, I want to get a baby and so forth. And I would specifically advise them about the zinc, that's the vitamin, the omega-3 and so forth. Right, and also about their diet. Nutritional deficiencies. Poor nutrition in fathers, especially deficiencies in certain vitamins and minerals, can negatively affect sperm quality and in turn influence pregnancy outcome. Stress levels. Some men become so stressed that people. Some men will say, I'm about to do whatever with their girl or their wife and so forth. They say they're releasing the stress, right? But it can impact. There's an impact on fertility and pregnancy. Chronic stress in fathers can impact sperm quality by altering hormone levels, which may reduce fertility. You know, high levels of stress may also affect the outcome of the pregnancy indirectly by influencing the mother's stress levels, leading to complications like preterm labor or low birth weight. And research has shown that potential stress can affect fetal development by influencing pregnancy-related stress in the mother, which is linked to increased risk of complications like gestational hypertension and preeclampsia.
So what you're saying is that before we all believe that, you know, it's the woman's job to have a son, to carry the baby, make sure the baby don't, you know, born too early, make sure she don't have a miscarriage. And now we're finding out that men have a significant role in these outcomes. So men, you can't blame us if you only have daughters. You can't blame us if, you know, baby is not what you expected it to be. Sometimes you have to look at yourselves. Okay, so it's not just the man or just not the woman alone.
Some men tend to blame women too.
Yes.
Thinking that it's the woman, and forgetting that they have a part to play. And a big the outcome of the child, a big part.
See, it's your important.
That's sperm.
Exactly. So men, you are vital. You're not just there to make baby. You're also vital for the health of baby. Okay. All right. This is what This is what I want the men to go out with tonight. Understand this, please.
Along with the physical aspects, are there any mental challenges that could influence pregnancy, like such as you mentioned about stress of the dad and how that could negatively affect, but can that even go a step further? Maybe if dad is depressed or has some sort of mental disorder, can that hamper the pregnancy?
Okay, all right. So paternal mental health, particularly depression, can have a notable effect on the pregnancy outcomes. Even though much of the research tends to focus on the maternal mental health, there's also paternal depression. And research has shown that paternal depression has increased the risk of preterm birth, low birth weight, and developmental delays in children. Depressed fathers may also struggle with bonding and emotional support during pregnancy, which can contribute to maternal stress. When it comes to the postpartum period, paternal depression can affect both the mother's mental health and the child's development. Studies indicate that fathers who experience depression may have a high likelihood of having children who develop emotional and behavioral issues later on in life. Right? And according to the JAM Psychiatric Journal, paternal depression is linked to 26% increased risk of adverse outcomes, including preterm birth and development issues, particularly when the father's depression persists throughout the whole pregnancy.
Wow. It would be quite interesting to know or to note the mechanism as to why those things happen, because intuitively you would think, okay, well, if daddy is depressed and I am in mommy, what does that have to do with baby, right? You know, because we sort of think about the physical and the mental in silos and not how they actually connect, and how that now in turn would be translated in the DNA and therefore in the baby. So we also now have to be cognizant of all of those integrations and how it's not just the mom as a carrier, but the dad as the seed, essentially. And all of men like to say, that's my seed, right? Well, no, you have to take full accountability of your seed.
Yes.
Yeah.
If you're somebody who smokes, tell yourself, okay, and especially if you're going to plan the pregnancy, you have to quit for a season, at least, right? And tell yourself, okay, then I am planning a pregnancy. It's not the mother alone to plan the pregnancy. Men have to prepare themselves also.
Correct.
So they have to quit the smoking, they have to quit the drinking, and they have to tell themselves, okay, I want a healthy baby, and this is what I'm going to do for my baby. Because at the end of the day, you need a healthy baby. You know what? Because you are one that create the outcome.
Exactly. And you mentioned that, and in the scientific world, we would call that epigenetics, essentially how the environmental factors affect the DNA. So you know, retracting from all of those lifestyle choices is what is going to change that DNA and hopefully to pass on good genes that aren't mutated, that aren't hindered in any way, so that the baby could have the best outcome as possible.
And there are some men that leave a stamp. The baby look just like them. Everything.
Take the face and put it on baby. So what about paternal age? Can that affect the outcome of the baby's health or pregnancy? Because I know some women, you know, they like to have a much older guy.
Yes. No, I believe some. You mean older women?
No.
Some younger women
Some
like
young women
older,
prefer
older men.
I believe older women love younger men.
And the reverse
That's
is
the reverse is true.
Right? Okay. Yes. Paternal age can influence pregnancy outcomes. You know, although the effects may not be as well known as those of maternal age, older paternal age, particularly in men over 40, has been associated with several risks. Yes, like increased risk of genetic disorders. Older men have a higher likelihood of passing on genetic mutations due to changes in sperm DNA over time. This change, you know, this can increase the risk of conditions such as autism spectrum disorders, schizophrenia, please take note, and certain genetic syndromes. Lower fertility also. As men age, sperm motility and quality can decline, making conception more challenging and potentially increasing the risk of miscarriage.
So for those who may not know what the term motility means, what does that mean? Is that how fast the sperm swims?
Yes.
Okay. So as you get older, typically your swimmer is going slower down.
So you got to do what you got to do now.
Okay.
Okay, so how should parents prepare for labor and delivery? Like,
okay. Read that.
Okay.
I'm going to read.
I'm going to read. Okay. Let's have my book. All right. For the past, let me see. For about 2 years now, we have been assisting mothers in terms of during the pregnancy by giving them a guide to help them to know what to expect during the labor and delivery period. All right? And this was created from the maternity unit. So it's a maternity guide preparing for the arrival and delivery of your baby. And it has a step-to-step guide from when labor begins right to the end and even after discharge.
nice.
All right? Okay, so expectant parents can begin preparing for labor and the various stages of pregnancy. Although the third trimester is when we focus on preparation becomes more intense. All right? In the second trimester, this is a great time for parents to start researching about childbirth options, including whether natural birth, cesarean section, whether they'll have an epidural, pain management methods. We don't have any prenatal classes. Health center does classes, like for deep breathing.
We educate each client as they come, and sometimes we do a general education.
Okay. All right. Know your blood plan. Have an idea what your plan is. Okay.
So we're gonna take a quick break, and we're gonna come back. So we're gonna have our personality spotlight, Dr. Dasima Martin Burkett, right? We're gonna just have her for a quick second, and we're gonna come right back to this interesting topic.
Our medical personality is Dr. Dasima Martin Burkett. Dr. Dasima Martin Burkett works in two distinct sectors of the medical field. Since 2023, she has served as the District Medical Officer at St. Peter's Health Center, focusing on managing non-communicable diseases such as hypertension. Also in 2023, after obtaining a Master's in Sports Medicine, Dr. Martin Burkett, upon returning to St. Kitts and Nevis, founded the Vital Care Medical Center, where she specializes in diagnosing and managing musculoskeletal injuries. This dual expertise allows her to assist individuals both in managing chronic conditions such as hypertension and diabetes and in treating injuries related to the musculoskeletal system. Dr. Martin Burkett completed her medical degree at the University of the West Indies in Jamaica in 2017. Following her studies, she gained experience in Jamaica's healthcare system, working in the Accident and Emergency Department at the University of the West Indies Hospital. Through her roles in community health and sport medicine, Dr. Dasima Martin Burkett continues to contribute to the well-being of individuals and communities. Our medical personality is Dr. Dasima Martin Burkett.
What's up with you? Girl, you look like you're off in dreamland. Focus.
Focus, it's Valentine's season. Love is in the air.
You not here?
So Dave said he loved me and I have 24 hours to respond. I'm thinking about what I'm gonna say.
That doesn't need turning. When he say I love you, you simply say I love me too.
What's that? And who even does that?
I do.
Me too.
I love you too simply means I love me enough to make myself a priority. And it starts with making wise decisions.
This Valentine's, I choose to abstain and to protect my name.
This Valentine, I choose education now, and this is my solemn vow.
I choose to keep my virginity and maintain my dignity.
Wise choice, because saying yes to him is saying no to you. I choose self-respect over self-neglect.
Okay, I get it now. I love myself too. This Valentine, Dave can keep his love. At this point in life, I choose self-love. For learning to love oneself is the greatest love of all.
Hey baby, you know I love you, right?
I love me too.
Alright, welcome back to our lovely viewing audience. We were just being prepped by Nurse Caines about what to expect during labor and delivery. And so I'll allow you to continue your thought.
Okay. All right. So we're speaking about the second trimester, and we're talking about having your birth plan. What birth plans your preferences are. All right. What you want for pain relief. Your position that you want to be in for labor.
I thought there was only one position.
No, we're trying to morph, change.
That's good.
So some persons will walk with the exercise ball to help them to do their squats in order to help along in terms of pain relief. And as the contractions come, they will be on the balls and you'll help them with squatting. Helps with preparation for the pelvic floor opening for when delivery is time. All right. In the third trimester, it's time, 28 to 40 weeks, around 32 to 36 weeks. Now you start to pack your bags to get ready to go to the hospital. So you prepare your baby clothing. Always best to wash the baby clothing before, especially new ones. You make sure you get them laundered before you put them on your newborn baby's skin. All right. And around your 28th week, we are encouraging you, mothers, to please book up, register. We call it booking. You register for your delivery at the outpatient department. All right? At the health centers, the nurses will give you lab forms for you to go to the hospital to take your blood samples, your second set of screening for your pregnancy. During that time, use that opportunity to get your booking done. The earlier you book, the better the outcome is for you and your newborn baby. For that period, we are able to assess and see if you have any of the the viruses that can be transmitted from mother to child, and we are able to treat you between your 28 to 32 weeks. If we wait too late to have your booking done, it delays that process of being able to treat you and prevent your baby from becoming infected. So we always encourage mothers to get that screening done for around the 28 to 32 weeks gestation. Then, you have your final check-ins with your doctors, and you get ready to come to the institution for delivery. All right? And the nurses on the maternity ward, they really do take good care of you and your baby. All right? And the doctors also. All right? Then once you come prepared to breastfeed, come with breastfeeding in mind.
Breast is best.
Breast is best. If you're not able to, we understand. All right?
Yes.
Because there are some conditions that we know mothers cannot breastfeed, and we accept that. All right? But come prepared to breastfeed. The book has information that can help you and gives you tips in order to tell you how you can mentally prepare yourself for breastfeeding. All right? We want to continue with our efforts that we have started and becoming a baby-friendly institution at the hospital. We want to continue that trait. All right? Breastfed babies are healthy babies. It helps in their general development.
Yes.
They are the smartest babies you can find in SK. All right? They're very smart. All right? It helps to prevent a lot of developmental challenges that children may develop. All right? So breast milk is best. So I touched on two things: preventing mother-to-child transmission of infections and breastfeeding. So come prepared to know these two. All right?
Yes, and I'd just like to say and boast. Yeah. I'd just like to say and boast, the Ministry of Health, we are doing wonders. Today we launched the maternal care navigators. We are 3 midwives, such as myself. Such as myself, we were chosen to be a part of this group to navigate basically the clients, the maternal clients, antenatal and postnatal clients also. We are adding to basically what the doctors are doing and what the nurses at the health centers, just that there will be, it's after hours, as we were given a phone and a laptop basically, so that we can keep abreast and keep communication with these clients. The numbers will be given out and so forth, and so these clients, the antenatal clients, you can contact us at any time. Yes, sometimes you find that one will say, but the doctor office wasn't open, and and if somebody's at their home and they need urgent attention right away, we, the navigators, will be able to call us via phone and ask us questions, and we'll help you throughout. We'll answer your questions, we'll tell you what to do, we'll advise you if it's something that is emergent. We will call the ambulance, and we'll do what we have to do, because we know that antenatal care is very important. Maternal care on a whole, as we said before, is very important, and so we'll be doing just that to make sure that everything is in place. We don't want to hear nothing of, we don't want no stillbirths and those kind of things, because I find that in pregnancy there some unnecessary stuff that takes place which could have been prevented. And so we as maternal care navigators will be doing that, just that, and we are only a phone call away. So you'll be getting the numbers, and more information will be coming forward.
Lovely. Yes. I'm happy to hear that the Ministry of Health is really taking
They're doing a great job.
Step to do that and give expectant mothers a lot more comfort and security within the
both in St. Kitts And Nevis.
Nevis.
Yes.
So it's both of us.
So
we're doing
we are
it.
one federation.
Yes.
Lovely, lovely. So even after the baby is born now, what are some quick tips that you would give moms in terms of feeding? I know sometimes some moms have low lactation, or they're not able to produce the milk as nicely as they would want to for the baby. So what would be some tips you would advise?
Okay, so once a baby is born, the focus shifts to ensuring the newborn's health is comfortable, and the newborn's health is comfortable, and the newborn is also safe, you know, as well as providing the mommy with support that she needs during recovery and transition to motherhood, because I'm telling you, there are some mothers that will be crying. You know, they'll be depressed.
Yeah.
The baby's crying, they don't know what to do. And so, you know, they'll be a little fussy, you know. And so the immediate postnatal period is critical for both mother and baby. And proper care is important for the well-being of both baby and mommy.
All right, so we're going to take another short break, and we're going to find out what's happening at JNF with Dr. Jensen Morton with a medical bulletin from the desk of the Director of Health Institutions. All right, we'll be right back.
Dr. Jensen Morton, the Director of Health Institutions, and I'm coming to you live from JNF General Hospital. We're here in the back part of the facility, and behind me is where the state-of-the-art MRI facility is being constructed. So we would have come to you some months before when ground would have been broken on the facility. The facility now is in the advanced stages of construction. In about 2 months' time, the construction should be completed, and when this construction has been completed, it will take us another 2 months to get the machine in place and 100% installed. So we're aiming for June to have MRI services 100% available to the citizens of St. Kitts and Nevis. So this is a very important update, and we hope to come to you in a few months' time, maybe when the machine is coming, and then later when everything is fully installed, such that everyone can stay engaged with all steps of the process. We'd like to thank everyone that's been supportive of JNF General Hospital. This is just one of the areas of improvement of the current facility. There are multiple things happening at the facility every single day, and we'll be sure to keep you tuned, as well as in tune with what's happening when we break ground on the new hospital facility just 1 kilometer to the west of this current facility. So, thank you.
National Home Loans. Home ownership made easy. When you're with National, you're home.
All right, welcome back, and so far we've been having a very interesting conversation with our two lovely nurses, being able to advise us on post, pre, and during pregnancy, the health of mother, father, and also the baby. So now, after the baby is born, we were speaking a little bit about breastfeeding and things like that, but what are some of the myths or misconceptions that persons may have about the baby after it's born?
Right. So there are several misconceptions that surround postnatal care. Addressing these can help ensure new parents are properly informed and prepared. So one myth, the mother should stay in bed and rest for weeks afterwards. All right? For some, based on cultures, right, like the Indians, what they do is the mom stays in bed while the grandma and the other elders in the home will take care of the baby. All right, so it's based on culture. All right, but while resting is important, physical activity as tolerated, light exercise can help speed up the recovery, prevent blood clots, and improve your mood. Early movements such as walking can support circulation and healing after a vaginal or a cesarean section. All right? You can't breastfeed if you had a cesarean section. How baby gonna eat? Breastfeeding can begin immediately after a cesarean section. One practice that we have initiated in the institution is skin to skin. Skin to skin helps the baby to initiate breastfeeding earlier, because once baby is on the mom's chest and on the amniotic fluid from the baby and the colostrum in the breast milk has the same sense. So baby gravitates towards that and starts breastfeeding. So even after cesarean section, it can begin there. All right? While there may be some form of discomfort, with the right support, new mothers can successfully breastfeed after cesarean section. Next one, breastfeeding should be painless. While the pain should not persist for a long period, there is some discomfort. And the discomfort varies, and it lessens as you continue to breastfeed. The more you breastfeed, the better it is for you and baby. All right? Positioning, proper positioning techniques help to lessen some discomforts. All right? So you make sure you don't put the baby on the nipple, but on the dark area around the nipple. So you know positioning is crucial in helping to reduce some of the discomfort you may feel. You need to wait until baby is 6 months old to start solid foods. That's the trick. But we encourage our babies to provide breast milk for our babies up to 6 months. Based on baby's weight and caloric intake, some persons will start with some solids. Once the baby is over a certain weight gain, they'll start with solids in order to complement the weight of the baby. All right? If a baby isn't sleeping through the night, it's a problem. No. Newborns and young babies have irregular sleeping patterns and may wake up frequently for feeding. And this is normal, not a cause for alarm or concern unless accompanied by other signs of illness. So fever, chills, irritability. Those are other signs that you look for. So baby just waking up and moving around looking for feeds, you give babies feed. Right? We don't have a time frame anymore to say babies have to be fed this certain hours, this amount of hours after the last feed. Feed babies on demand. And that's what we encourage in the hospital and even when babies go home. Feed on demand. All right? Babies know when they're full and they will stop.
Yeah.
All right?
Yes. All right. What about checkups? So after maybe the initial going home of the parents and the baby, and then so what time how much time should I go back to the doctor, or how soon should I go back to the doctor or the hospital for a checkup?
Okay, newborn checkups are important to ensure the baby is healthy and developing normally. And you know, he has went to visit the doctor. Routine checkups, babies should have their first checkup within 48 hours after leaving the hospital, followed by checkups at 1 week, 2 months, 4 months, 6 months. Basically, as soon as a mommy gets out of the hospital, you know, I'm sure the nurse at the unit would tell them to go straight to the health center. You know, because you have to start immediately. Sometimes I find that, especially even sometimes some babies are born overseas, sometimes the children basically come to the health center like 3 months, 4 months, and no, we don't want that. We want you to come to the health center as soon as you get the baby, so we can start care, we can implement everything that needs to be implemented.
Immunization.
Yes, immunization especially. You know, because you know that the baby needs to be protected against a lot of diseases. You know, these visits allow us as healthcare workers to monitor the baby's growth, development, and immunization schedule. Right? We advise mothers to please, well, there are so many debates about the vaccines and so forth. You know, I find that especially after Corona, there are so many, you know, but we have been doing what we have to do, you know, to really encourage the clients to, you know, we are not giving the babies Pfizer. We are giving the babies basically what you receive when you were a baby. Yeah. And we're just asking you to bring the babies out to be immunized against these dreadful diseases. Yes.
All right, just to add, for moms, for babies, when you take home your baby, when you leave the hospital, you'll given an appointment to see the pediatricians in the health centers. And it's usually be 4 weeks or 6 weeks after birth. And the health centers are Newtown, Caines, and Sandy Point Health Centers. That's where the pediatricians are on different days. So mothers can they're given the card and they follow up with the pediatrician in the community versus coming back to the hospital to see the pediatrician.
And also, the care is continuous, where you find that even when the baby is 6 months, the pediatrician gives an appointment for the baby to come back. So I'm telling you, Ministry of Health is doing wonders. Yeah. You know, these steps are, you know, I'm sure that, you know, health is going to go to the, you know, to the top, right? And yes, so there's so many things that are happening for health, and so we want to again implore the clients to come to the health center.
The service is free.
The service is free. You know, I remember I met a client, and we were talking, and I saw that she was pregnant, and I said, "What happened? I'm not seeing you at the health center." And she said, "For what?" I said, "For antenatal care." And she was like, "What, I don't know about that." Wow. You know, so we offer antenatal care. Each health center have their dates. Maybe all health center dates, right? But each health center have their dates as to when you must come for antenatal care. And as I said, we do so many things. We listed everything that we do tonight, all the tests and so forth. And when you hear some persons who sometimes they cannot even financially afford it, they say they spend $900 and something on these tests, and it was so hard for them, and you know. But
at the health center, you get them done free.
Oh yes,
free.
Yes, everything there is free. Please, right. So come on out.
So make use of the service.
Yes, make use of the service. I know that we're not speaking about this topic, but yes, come on out for your pap smear also. Kindly, please, ladies. It is free, and we just recently introduced men health. Each health center has introduced men health. So men, come on out. You need to plan your pregnancy. Come on out. Let us run the test. Let us do what we have to do. Come and see the doctor.
We have to have another episode so you can come and tell us about men's health and everything. But for now, we definitely have to wrap up.
Yes. So we're gonna do a quick recap, right? So today is World Health Day. The theme was antenatal care and newborn health, where tonight we discuss what is antenatal care, how fathers can influence the health of the newborns and the mothers as well, the steps that we need to take into consideration when planning to have a baby while we are pregnant and after baby is born. Okay, so one of the health tip that we want you to remember for the week is prioritize antenatal care for a healthy pregnancy and baby. All right. So today the health centers had antenatal care day for all antenatals, and tomorrow their focus will be on the newborn care. All right, so tomorrow you can visit any of the 11 health centers around the island from 8 to 3 p.m. So you'll get guidance on your baby's milestone, the magic of exclusive breastfeeding, vaccinations, equal protection, and so much more. So please, ladies, men, you take this opportunity to learn more about your newborn care. Please. All right? All right. So this was a very interesting topic tonight. We enjoyed ourselves. We learned so much, and we hope that you learned so much as well. We're going to see you next time on the next episode of HealthWise. Good night, everyone.
Good night, everyone.
Good night.